up? May I come in?
Yes.
Hi, my name is Charleen. I'm an MS and FNP student working with Dr. Masters today. Just going to get you admitted to the clinic, okay?
Okay, perfect.
All right. Can you tell me your name and birthday?
Catherine Sims, 12564.
Okay. Can you tell me where you are and what year it is?
It is 2018. I am at the Research Health Clinic.
All right. And what brings you in, Catherine?
Pain and numbness kind of in my right hand.
Okay. Are you right-handed?
Yes, ma'am.
Okay. I would note patient is an overweight, middle-aged Caucasian female who is right-hand dominant. And can you tell me when this started? Did it start suddenly?
Suddenly, a few weeks ago.
Is it constant? Does it come and go?
Comes and goes.
Okay. And can you point exactly where your symptoms are?
Kind of these three fingers right here. And
So it starts there and kind of radiates down to your fingers?
Correct.
Okay. And how long exactly has it lasted?
A few weeks.
A few weeks. Okay.
Okay,
and you said it has the pain and then accompanying kind of numbness.
Correct.
And tingles. Okay. Anything that seems to make it worse?
Like typing and like at night it seems to be worse.
Worse.
Like when you, lay down.
Okay. Anything that makes it better? Just shaking out your wrist? Okay. Any medications, anything you've tried for it?
Nothing specific for this, so.
Okay. And you said it's worse at night when you're typing. Any other patterns you've noticed?
No, just, that motion.
Okay. And if you had to rate it 0 to 10, if 10 was the worst pain, it really limits what you're able to do.
7, 8-ish, probably.
Okay. And any recent ill contacts that you've had?
No.
Okay. And you'll note me just writing here, making sure we have your medical history up to date, okay? So I see that we have a medical history of hypothyroidism, obesity, ovarian cyst, endometriosis, osteoarthritis. What joints is that normally? Mostly in your knees. Any in your upper extremities that you've noticed?
No, not really. Too bad. Yeah.
And then a history of kidney stones, vitamin D deficiency.
Correct.
Anything else?
Not that I can think of right now.
Okay. Still taking estradiol 1 milligram daily, multivitamin daily, Synthroid 100 micrograms daily, vitamin D 50,000 international units weekly and 5,000 daily, and then Norco 5325 every 4 hours as needed for pain.
Correct.
Okay. Surgical history, C-section ×2, multiple exploratory laparotomies, recent knee replacement on the left, total, sclerotherapy and lithotripsy.
Hysterectomy.
Oh, the hysterectomy. Okay. Anything else I'm missing?
Nope.
Okay. And are you a smoker? Ever been a smoker?
But November 4th, 1990, 4:30 in the afternoon.
Okay. How much did you smoke and for how long?
Pack a day approximately for 10 years.
Okay. Any alcohol use?
About 1 drink a month, probably.
Okay. Any other substance use?
No.
All right. Are you married?
Yep. With 2 kids.
2 kids. Okay. What do you do for work?
I am a substitute teacher, and I help with our company that we run out of our house. So.
Okay. And still, you have a lot of typing and everything involved in those jobs?
Billings and, things like that. So.
And what hobbies do you have? If any?
I like to walk and cross-stitch.
Cross-stitch, okay.
Knees kind of put my walk in hold for a while.
That's all right. For family history, we just have that your mother has generalized anxiety and esophageal hyperplasia. Father has type 2 diabetes or had type 2 diabetes, hypertension, and then was deceased of an MI at age 59. Maternal grandmother, MI in her 80s. Paternal grandmother, type 2 diabetes. Paternal grandmother, 70s. Paternal grandfather, prostate cancer.
Died in his 70s.
And
paternal grandfather.
MI?
Yes.
Okay. Maternal grandfather, you have prostate cancer. Okay. Okay. And any fever, chills, unexplained weight loss, increased fatigue that you've noted?
No.
Any joint pain other than, I'm assuming, still the left knee and then in this wrist?
Yeah.
Any of your other joints?
No.
Any swelling other than, I know you still have some in the left knee that you've noticed?
No, I haven't noticed any.
Skin feeling tight. Okay. Have you noticed a decrease in your ability to move that wrist around?
Yeah, somewhat a little bit with this.
Some decrease with the...
Probably just, when it hurts, you don't want to move it. So.
Okay. And then I would note the patient is alert and oriented. Any dizziness that you've had?
No, not that I'm...
And then any numbness or tingling, paresthesias elsewhere
No.
other than in the wrist.
No, just
Good. Any open areas, any abnormalities you noticed on your skin? Just note that you have the incision to the left knee healing well. My medical assistant got your vitals. Blood pressure is 118/76, heart rate 64, respiratory rate 14, temperature 98.6 Fahrenheit, oxygen 99% on room air, so those are great. Note that patient is in no acute distress, dressed appropriately for the weather. Now I'm just going to do a bit of a physical assessment here for you. So first off, I'm going to check your grip strength. Just squeeze my fingers on both sides. Good. And then I'm going to test your ability to move against resistance. So you're going to move your wrist outward against me. Very good. And then pull in. Okay? And then same on this side, outward against me and pull in.
Okay.
Good. Strong grip strength, 5 out of 5 bilaterally. Next, I'm just going to do a couple of special tests to rule in a possible diagnosis. Okay, so I'm going to have you put your right wrist out on the table.
Okay.
This first test is called Tinel's. I'm just going to tap on your wrist. I want you to let me know if this seems to replicate your symptoms. Make you have pain, numbness, tingling.
Yeah, I can feel it.
Where are you feeling it?
Fingers.
Your
Yeah,
fingers?
these 2 fingers and my thumb.
Any on this side?
No,
Okay.
that's weird. Okay.
And then this one is called Phelan's test. So like I'm doing here, I'm going to have you push your hands together.
Oh, how far?
That hurts?
Yeah.
Okay. Any numbness, tingling with that? Go ahead and stop. I would note positive test, really unable to tolerate that for the full time period. And then the last thing, I'm just going to have you reach that wrist out again. Just going to put a little bit of compression in your carpal tunnel area here. Any increased pain, numbness, tingling with that?
Yeah.
Yeah.
That's weird.
Okay. I would note positive for all 3 of those special tests.
Okay.
Any numbness or tingling in other joints or anywhere else in your body that you've noticed? No? Okay. I'm just going to test your sensations to both sharp and dull. So I'm going to have you reach both wrists out for me here. Close your eyes.
Okay.
And then I'm just going to touch you with the cotton swab or on the pointed end of it. You let me know what you feel me tapping and what side, okay?
Soft on my left.
Okay.
Sharp right. Soft right. Soft left. Sharp left. Soft left. Sharp left. Soft left. Sorry.
Okay.
Soft right. Sharp right. Soft right.
Okay.
Soft left.
Okay. I would know intact sensations, particularly along the median nerve pathway. Now I'm just going to, again, have you close your eyes, and I'm going to kind of touch on you here. I'm just going to have you tell me if you feel me touching with 2 points or 1, okay?
Okay. Up. Okay. 2. 2. And 1.
Okay.
1. I don't know.
Let me do it again.
Yeah. 2. 2. 1. 2. 2. 2. 2. 1. 2. 2.
Okay. I would note appropriate 2-point discrimination. Now I'm just going to check your eyes here. Have you look at my light straight ahead. Okay, and follow it in. Okay, I would note perla and a pupil diameter of about 4 millimeters.
Okay.
And real quick, I'm just going to check your pulses here on both sides. Okay, capillary refill, just make sure you get good blood return in your distal extremities. Skin turgors, non-tinting. No edema noted on assessment. Skin is pink, warm, dry to the touch. Now, last thing I'm going to do is just assess your reflexes here.
Okay.
All right. Now we're good at relaxing.
Not a good relaxer.
I'm just gonna have you relax your arm down on your thigh here.
Okay.
And you're gonna feel me tapping. This is testing your brachial reflex.
Okay.
Or your bicep reflex, excuse me.
Mm-hmm.
Do you feel a muscle
Mhm.
twinge with that?
Yes.
Okay.
That's weird.
This is pronator teres. Just relax.
Mm-hmm.
Feel that?
Mm-hmm.
Kind of. There we go. Do you feel that?
Mm-hmm. Kind of like a contraction.
Feel like your muscles
Mm-hmm.
twinge. Okay.
Okay.
All right. Then I'm going to tap on the back of your arm here. Triceps tendon.
Ooh.
You feel that?
Uh-huh.
Okay. I would note diminished reflexes because she doesn't have significant movement with it, but she is able to feel that and has a noticeable contraction of that muscle. It's subtle, but it's there. Same on this side. Ooh. Feel that?
Mm-hmm. Ooh. Yep, I felt that.
Feel that?
Didn't really feel that
No,
one.
feel that one. Try that again. Just relax.
Okay.
No?
A little, yeah, kind of a twinge. Yeah.
Okay. Still not diminished on that side as well. Just relax your arm here. Feel that?
Mm-hmm.
Okay. Diminished reflexes throughout.
Sorry.
That's okay. So for you, your first diagnosis, most likely diagnosis would be carpal tunnel syndrome because your symptoms you tested positive for all three of our special tests,
Okay.
and to rule it in, and then your symptoms kind of follow where the median nerve that runs through your carpal tunnel would be. Another possible diagnosis would be radial tendonitis, and then you could also have some osteoarthritis in that joint that's causing some of those symptoms that can cause pain and numbness.
Okay.
So those would be my three differential
Okay.
diagnoses for you. Any questions?
Nope.